I think we'll begin. So I'm just going to share my screen with all those on the line. Okay, and I hope everybody can see the opening slide for the annual address in the Department of Surgery. Unusual times, I think you would all agree. Not only are we coursing through a pandemic, but we're also today honoring the event that occurred 19 years ago, which was 9/11. I think we all remember where we were at that time. So we're kind of in the midst of a second world crisis right now, having survived the 9/11 catastrophe, world catastrophe. Uncertain times perhaps ahead, but what I hope to do today is to review for you the events in the Department of Surgery this past year and show you how, despite even calamities in the department, in the environment, University of Toronto, in the world, that we carry on with our core businesses. So with that, these are some of the highlights from 2019 to 2020. So we published the academic business case for global surgery. We formalized the surgeon entrepreneur job description. We initiated phase 2 in the wellness program. We published a very good article as a roadmap for the SSTP for research fellows. We created the first time ever merit awards for junior faculty in the Department of Surgery. We had a white paper on parental leave that will be spoken to a little bit later today. We hired equity, diversity, and inclusion co-directors. I will be speaking about the impact of COVID-19 on our practices of surgery, and we raised a significant amount of funding in the Department of Surgery. The backdrop that you see today is actually the Department of Surgery. I have not spent a lot of time in this office since March, actually. However, time to time I do work here. It's fairly quiet. All of the department staff that you see here that are on the screen are essentially working from home and doing so very ably, very capably, and I want to take a moment to thank them for all of their contributions to the Department of Surgery this past year. Special thanks for this particular presentation to Stacy Krumholtz, medical illustrator, who helped put these slides together with me, and also Sylvia Perry, who provided the content for the slides. This year we had a number of university rounds. We started with the Bigelow Lecture. We had the Lister Award presentation by Cindy Mooreshead, Robin McLeod lectureship, the Ben Allman presentation, and Daniel Martin gave the Kurgan lecture. We had 2 presentations that had to be canceled because of the pandemic, so the Palmer lecture and the Harlan Smith lecture, but have no fear, these individuals have been invited back for this coming year, and so they'll be put back on the roster. And then we had the Tile lecture at Sunnybrook hosted by Avery Nathans. We also had the Global Surgery Symposium. I think you'll remember the 5th annual. Ewan Harrison came from the University of Edinburgh. Bob Bell gave us a joint medicine surgery presentation, and we had a global surgery presentation on Chernobyl after the fallout as part of the program in global surgery. The Department of Surgery Book Club was quite active, and we had read Catch-22 by Joseph Heller and Bob Bell's book, HIP, a novel. Anybody interested in reading this book, let me know. We have copies in the office for all of you to enjoy reading. Just a word about COVID-19 and its impact on surgery. I think you'll remember these were rather difficult times for all of us, but a special thanks to all of you as faculty, all of the fellows, all of the residents in particular, many of whom were redeployed into the different units, intensive care, burn units, step-down units, trauma units, and so on. So really big thanks to all of them who participated at a very high level at a time of need. We thank all of you. Note to George Oriopoulos, thank you for your incredible donation for the purchases of PPEs for those in need on the front lines. On a somewhat lighter note, we held our COVID-19 art showcase, and these are now posted on our website. I encourage you to see all of the artistic genius of our faculty. So we have poetry, we have stained glass, we have sculptures, we have garden design, we have watercolors, haiku, we have sketches, anatomy sketches, beautiful watercolor and oil paintings. So congratulations and thanks to all of our surgeon artists who supplied this, this work to us that we could post on our website. It's been posted also on Instagram and social media. So you should take a look at it, and just as a reminder of the talent that is embedded in the Department of Surgery. Our leadership is listed on this slide, and I couldn't do the work of the Department of Surgery, of course, without the able assistance of the Executive Committee and its directors, both education and research. So many thanks to all of them for helping me run the department this past year. This year, the university division chairs are gearing up, of course, for accreditation. I'll be speaking more about that, but many thanks to them for running their programs and making them as good as they can be. I'll be saying a few words more. The surgeons in chiefs were really called into action this year, and we held many Zoom conferences with the surgeons in chiefs by virtue of the fact that it was important to me to discuss best practices amongst the different surgical groups and to determine where we were all heading in the apex of the pandemic. So I think that was a very valuable time for all of us, and thankfully things have settled, but a special thanks to all of the surgeons in chiefs. This is the education and research team, and many thanks to them. As mentioned, we have 2 accreditation processes coming forward, the medical school and also the residency programs. I'll be speaking more about those subsequently. Again, the program director is playing a big role throughout my term as chair, but particularly this year coming forward for accreditation by the Royal College. We had some chair reappointments, so Tom Forbes, Avery Nathans, and Carol Swallow were all reappointed in their chair positions. Peter Dirks was a recipient of the Harold Hoffman Chair, Tulin Sil, the Gaddisel Chair, and Geller Izadeh, the Dan Family Chair in Neurosurgery. There were many new key appointments that I'd like to draw to your attention. They're listed on this slide. You can read the names, but essentially presidents of various organizations, members of editorial boards, hospital heads, Homer Tien, president and CEO of Orange, Greg Borchell, president of the American Society of Peripheral Nerve. Other key appointments, hospital heads, interim and associate chiefs listed here. Mingyao Liu, big reappointment with the directorship of the Institute of Medical Science. Michael Taylor, and now recently announced Karen Davis as members of the Royal Society of Canada and its fellowship. Moving to promotions, we were very successful this year. All candidates who went through for promotion were promoted, so we're delighted about that good news. Tulin Sil, Sunil Kalia, Nicole Lukang, Catherine O'Brien, associate professors, Anne O'Neill, George Oriopoulos, Ivan Radovanovich, and Rajiv Singhal, also associate professors. For full professor, Robert Cusimano, Joel Fish, Mohit Kapoor, and Aaron Kennedy. So normally at this stage, I would ask for a round of applause, but tell me if you can hear this. So congratulations to all of our promotees, and we did celebrate. We couldn't meet in person, of course, but we did the next best thing, which is to meet on a Zoom conference and here celebrating with a pizza night. And we did this a number of occasions with a number of celebratory groups throughout the pandemic, and it actually worked out quite well. So congratulations to all of our promotees. One professor emeritus, Bill Williams, transitions from practice, James Mowney, and also Bernd New. And we move now to continuing appointment reviews, and listed here you can see Nir Lipsman, Sav Brar, Jeff Wilson, Amit Atri, Sami Chadi, Louise Daluz, Barb Haas, Tim LaRue, Bijma Ravi, Mohammed Kadri. You can see we moved from meeting in person to meeting by Zoom. So as was mentioned, pretty much all the core businesses of the Department of Surgery moved quite ably and readily into Zoom or virtual gathering modes throughout the year as we needed to, as was necessitated by virtue of the pandemic. So congratulations to all those who received their continuing appointment reviews. Sadly, we lost a few giants in our Department of Surgery listed here, 2 in my division, neurosurgery, Robin Humphreys and Todd Mainprize, Keith Moore in Division of Anatomy, and Bob Filler, tower of a leader, surgeon-in-chief previously at Sick Kids, pediatric general surgeon. Sadly, if we just have ask you just for a moment of silence right now to remember these stalwarts in our Department of Surgery. Okay, thank you. New faculty recruits listed here, part-time, adjunct, and status. These are the full-times, Andrea Chan, Yana Dengler, Ashley Nadler, Kim Choi, Jeremy LaRouche, Rachel Bartschiger, Blaine Saeed, Laura Donahoe, Harman Chowdhury, Andrew Beckett, Seung Park, Ashish Kumar, Raman Mundi, Chris Wichu, Ryan Paul, and David Barron. So congratulations to all of them. This is a big deal to start your faculty appointments. So a round of applause to all of our new appointees in the Department of Surgery. Okay, advancement. We had a banner year once again in advancements. Thanks to Effie Ordon, our Senior Development Officer, nearly $3 million in pledges and gifts, hundreds of donors, pledges, major donors. I'll be speaking about these fellowships and scholarships shortly. Here's the breakdown of funding in the Department of Surgery between clinical education, the SSTP program, global surgery, and research. So a tremendous opportunity for us to raise funds for the department this past year. Special thanks to Neil Fleshner for raising a $10 million gift to the General Urinary Biobank celebration in the name of Michael McCain, shown here, President Merritt Gertler, Dean Trevor Young, and others, Kevin Smith, UHN President and CEO, all together for this remarkable achievement and initiation of the biobank. As is customary with my annual addresses, I do refer back to our strategic plan. And here's the 2018 to 23 plan that you can see with its pillars of research, education, best practice, global outreach, innovation, and faculty development, with the supporting strategies being communication, awards, evaluations, and advancement. This is the research committee led by Michael Failings and supported ably by Val Cabral and the entire committee, which is a very functional, very active committee. Many thanks to them. Interestingly, since 1983, almost 450 SSTP graduates or continuing members in the program. And currently there are 39 enrolled and 10 new ones for a total of near 50. If we look at the map here for 2020, what you see on the far right-hand side of the screen is pretty much a stable number now. We're kind of in balance to where we wish we would be and continue to be. We had to make some tough decisions about how many entries into the SSTP, but now I think we're in a very good position to be able to support this number or close to thereabouts. If you're wondering who the SSTPs are, they basically cut across all the divisions as shown here for master's and PhD degrees, and you can see the representation in the different divisions on this slide. In terms of funding, this is a multi-million-dollar enterprise. As you can see in 2019-20, you can see the breakdown of the sources of funding that go to support the SSTP. In particular, I should like to thank the supervisory support from all the supervisors who are caring for the training of their residents in the laboratory and the big allocation of funding that they've put into this. So thanks to all of you. I'll be speaking a little bit more, but we've had some Surgeon Scientist Trainee Awards, Wayne Carmen, Giuseppe Papia with the Marzilli Scholarship, and Bob Magisano for the Scholarship in Vascular Surgery. Research grants and contracts, the second highest amount for 2019-20, hovering always, which is very interesting to me, around 90,000. The first 5 years that I was chair, we were between 40 and 50 million. Now we've doubled that amount, so congratulations to our faculty for truly garnering huge research support these past 5 years. I'm very satisfied with where we sit on this particular graph. And very impressive high impact publications shown on this slide. New England Journal of Medicine, Lancet Neurology, Nature, Nature Genetics, Lancet Oncology, Nature Genetics, and so on. And Michael Taylor, a Clarivate list of highly cited authors in the world. So our faculty are publishing many of them at the highest level imaginable, and kudos to all of them. This is the article I mentioned near the beginning, where we published our essentially the way in which the SST is structured and how valuable a program it is, thanks to Kevin Joao and all of the residents and faculty who helped to put the roadmap together for the Surgeon Scientist Training Program, now published in the Journal of Surgical Research. You can refer to this. And again, special thanks to Neil Fleshner for the initiation of and establishment of the Hold 'em for Life Oncology Clinician Scientist Awards. 16.4 million to date, and this supports not only the Department of Surgery residents, but also radiation oncology and medical oncology. And in the bottom right, you can see the SSTPs who have been supported by this fund to date. Okay, I spoke earlier about accreditation, and we have two major accreditation cycles coming forward. The first is in the medical school. Please note November 2nd to 6th, 2020, CACMS, that stands for the Committee for the Accreditation of Canadian Medical Schools. Preparations are underway thanks to Najma Ahmed and her team. There will be a follow-up site visit later in December. A number of curriculum changes have occurred, but we're looking forward to undergoing accreditation and having the medical school accredited. Special thanks to Jeremy Hall as director and Alyssa Greco as the Assistant Director of Undergraduate Medical Education in the Department of Surgery. I did meet, as is customary, with the medical students on a variety of occasions, here seen with the University of Toronto Mississauga medical students with Jeremy Hall, and we went there to give some feedback, some lectures, some presentations to the medical students, and then in the boardroom in the Department of Surgery here, meeting with the medical students at U of T Central. Did this a number of times. These particular types of meetings I'll be hosting virtually this year. The postgraduate education is also coming forward for accreditation. The dates are November 22nd to December 4th. Thanks again to Najma. You can see the accreditation preparations are well underway. All of this is on the website you can refer to, but huge amount of planning is necessary for us to go through accreditation. Special thanks to Mark Wheatcroft, who's already leading the Surgical Foundations lecture series delivered virtually. I attended part of the first presentation. It was excellent, and it's all moved, as I said, to a Zoom-based format. And special thanks to Ron Levine as the Director of Postgraduate Education for everything that he's been able to do with Najma to get us prepared for accreditation. Okay, we'll move next to best practice in surgery and Robin McLeod's very, very capable work. Robin's very interested in environmentally sustainable operating rooms, so all the waste and the debris from the operating rooms after surgery, it's a tremendous wastage, and so Robin's looking carefully with groups from anesthesiology, nursing, and administration to decrease that amount to make it more of a green environment. Also, there's been tremendous work on the study of abdominal surgery and management during COVID-19. Anthony DeBuckin Group has been leading the charge here, producing these guidelines during the pandemic. Last year, we were able to publish a guideline for the prescription of pain medications at the time of discharge, so post-operatively, led by Hans Clark, supported by Robin. And this was published in the Canadian Journal of Surgery. Post-operative opioid prescription patterns among surgeons and residents. So extremely important work, very timely, and as I said, work that is ongoing currently and will help all of our faculty and residents as we look after our patients. And then a guideline led by Ashley Nadler about adhesive small bowel obstruction. This has been submitted for publication. So this particular group, Robin's group, has been extremely productive, extremely effective. And Najib Safiaddin, from whom you'll be hearing shortly, has been leading a quality improvement course, and the projects that the residents undertake are really spectacular and worthy of pursuit, and could possibly lead to tremendous cost savings in all the hospitals if they were followed by the hospital administration. So Najib, thank you very much for all your help with this QI curriculum. Next to global surgery, Avery Nathan's leading the charge here. And you can see we published our academic business case for the global surgery program. If you look at a map of the world, you can see where all of us are involved in various regions in global surgery efforts. It's quite a remarkable spread across the entire world. So we thank all of our surgeons for being actively involved in global surgery. I'd already mentioned the 5th annual symposium by Ewan Harrison, shown here in my office. And in days when we could meet in person, we would have celebrations for events like this prior to the pandemic, and we look forward to getting back to these types of events in the future. I should like to draw your attention to the establishment of the George and James Swan Chair in Global Surgery, a $3 million endowment by the Temerty Family Foundation, and also James Swan is cardiologist who previously worked at the University of Toronto, an affiliate hospital. And Lee Arrett is the current shareholder of this chair, with his efforts being supported in Jamaica, China, and Nunavut. At the bottom of the screen, what you see is a hospital that Lee helped to contrive by virtue of putting C-cans together and refurbishing those to act as a mobile hospital. So congratulations to Lee on the establishment of this remarkable chair, which will go further to enhance our profile in global surgery worldwide. Innovation, just one of many things that SHAF reported on, is the 3D print heart model, here shown with Osami Hanjo, Osami Associate Professor, utilizing 3D printed hearts to help residents and fellows learn the nuances of how to operate on pediatric congenital heart disease. So congratulations to Osami, and thanks to SHAF. Ori Rothstein leading the charge for faculty development. Ori has been instrumental in leading all of the continuing appointment reviews that I mentioned earlier. Here is the faculty development day that was held. Mara Goldstein was the keynote speaker that you can see here. This was a great event between surgery, anesthesia, and otolaryngology. This year, we've decided not to hold it just because of the pandemic and some of the challenges that would be imposed upon us by trying to do this virtually, but we will get to this once again next year. We do have a very strong program that's continuing in wellness and burnout, led by Joe Papia, organizing now a number of group meetings, rounds and lecture series. Recently, we've acquired a very generous donation that will help to catalyze our academic efforts. This donation was courtesy of, and with special thanks to, Robin Richards. And this will enable us to grow this program even further. Okay, so I'm delighted to remind you that we did appoint 2 co-directors for equity, diversity, and inclusion in the Department of Surgery, and they are Laura Snell, and who's a plastic surgeon at Sunnybrook, and Najib Safiuddin, who's a thoracic surgeon at Michael Garron. And because of the format of today's presentation, I've asked them to say a few words about their new program and how they're getting off the ground with their initiatives and what their plans are going to be this year and for the near future. So with that, I'm going to turn it over to Laura and Najib, and they'll explain and they'll take turns going through the presentation, and I'll just remind them to remind me when they want the next slide positioned. So Laura, over to you.
Okay. Thank you very much for the opportunity to allow Najib and I to introduce ourselves at this year's annual address, which is virtual, obviously. As Dr. Rucka mentioned, I'm a plastic surgeon at Sunnybrook, and I've been there since 2010. And I have a keen interest in equity, particularly when it comes to gender-related issues. So today we'll provide you with a little bit of a backdrop or an introduction to some of our efforts, and then I will switch it over to Najib to present our strategic plan for the Department of Surgery. Next, please. I think no one can deny that this year has been something. It has been a crazy year. The world seemed to turn upside down almost overnight, as everyone recalls, in March 2020 with the pandemic. But we've also been reminded throughout this of disproportionate health disparities and disadvantages faced by Black, Indigenous, racialized, poor, and other marginalized groups in our society. Next, please. Medicine is certainly not immune to many of these important issues. Next. There have been many Canadian medicine-specific equity and diversity issues recently highlighted in the media, as you can see here. Next. At U of T, we are all part of a world-leading Department of Surgery when it comes to research and innovation, education, and patient care. But we are not yet leaders in issues of equity, diversity, and inclusion. And with this comes incredible potential and opportunity to make a huge difference. Next. But first, we need to all start with the same understanding of what EDI means. And EDI, of course, stands for Equity, Diversity, and Inclusion. So starting with equity, equity as opposed to equality provides opportunity to all persons that is responsive to potential disadvantage, bias, or discrimination. For example, think of the Black or Indigenous medical students that are interested in surgery and would like to apply to surgery, but their CVs are compared head to head with some of the other applicants who maybe have had advantages that they have not since the beginning of their interest in surgery. So that is what we are working towards with respect to equity. Next slide, please. Diversity is different, of course. It refers to the involvement of different types of people within an organization, such as the Department of Surgery. And there are many known benefits of diversity, including improved decision-making, improved problem-solving, research productivity and innovation, community engagement, improved patient care, as well as worker satisfaction and engagement, which of course is linked to wellness. Next. Inclusion, which is almost considered to be the next level beyond diversity, refers to bringing the diverse members together in a harmonious, productive, and positive way. And this is where many of the real benefits of diversity can be seen. Next. So how diverse and inclusive is our Department of Surgery? Well, we actually don't know this quite yet. Next. Since Najib and I began this role in late May 2020, in the midst of the pandemic, we have spent a lot of time meeting with other local EDI experts within the Faculty of Medicine. We've learned we have many resources and many experts within the Faculty of Medicine that have given us great guidance and have a lot of opportunities for us to collaborate on in an ongoing way. We've also met with many of our own members, and some of these issues that they have mentioned are represented here on this slide. We have used these issues to shape our strategic plan, which Najib is going to present next. Next. And I'll hand this over to Najib.
Good morning, everyone. My name is Najib Safidi, as been mentioned. I'm a thoracic surgeon, Michael Guerin, and part-time at Sunnybrook. I come to this from an activist social justice perspective, and I just want to thank Jim for the platform and thank Joanna Giddens on both of our behalfs for the great work she's helped us with. I'll come back to the survey in a minute, but I just want to put a word out there to please do fill out the survey. The more of you that fill it out, the more we can help and to make this work benefit everyone. Next, please. So given all that Laura has talked about, we have put together a strategy for the next 3 years, which is our mandate, in the hope of working towards a department where equity and diversity are values that are core to our department and that inform policy and shape culture. And so the two areas we're going to focus on are cultural change and structural change. They're not one and the same thing, obviously, but they're very much interrelated. Next, please. So in terms of structural change, we know this has to be thoughtful, deliberate, and we know it'll take some time and it has to have buy-in from everyone. So this is a long-term project in terms of addressing these specific topics that are listed here on the slide in the hope of making significant change, update, or new policy in every one of these areas by the end of academic year 22-23. Particularly, I wanted to mention, aside from the obvious ones, the complaints process. We know this is a tedious and long process, and it intertwines between hospital, department, and faculty, and sometimes that's prohibitive. Our role, we feel, is twofold. One is to help streamline and make this venue more user-friendly for membership to access, but also ourselves, although not a formal complaints a venue, to have an informal way of listening to people's complaints and their experiences to try to be able to help. Next, please. In terms of cultural change, there are three areas: education and training. We know from evidence, the best that is out there, that education and training and empowerment of leadership and administrators has the most impact on cultural and structural change. And so we hope to engage and continue to engage with our leaders to train and learn about EDI so they can affect that change. In terms of our general membership, we hope to incorporate EDI into the faculty development strategy, which already exists, and make it an integral part of it. And of course, our learners who are going through formative professional years, to engage with them through the foundations course in PGO 1 and 2, and through the individual divisional teaching sessions that happen every week on different divisional levels. And we have had great support from the division heads so far. In terms of membership empowerment, what we mean by that is education and tools for membership to be able to, on every level, to be able to challenge acts of racism, discrimination, any other sort of inequity type of behavior during their workday, in the OR, on the wards, in conferences, and so on, to create an environment where such behavior that is already obviously not condoned is actually very unwelcome and challenged on the spot. And in turn, last but not least, community engagement. And why this is important is that individuals and communities that come to the department and experience these issues obviously come from communities, and it's incumbent upon us to educate ourselves, to learn, and to engage with these communities, whether through consultation or initiatives, to really make this work worthwhile and for people to really understand where this is all coming from. Next, please. We hope that when we do this, we are very transparent. We hope to strike together a working group in the next couple of months that will be very representative. We will continue to consult with all the people that we have consulted with and work very closely with the Faculty of Medicine that has great allies and has amazing resources and has been very helpful. We want to continue to reevaluate what we're doing with feedback and to adjust as necessary. And we want to keep our communication lines open directly through email or phone, whatever works for our members, but also through indirect venues such as Galley Day or presentations or the Spotlight or others. Next, please. So in terms of concrete next steps in the immediate future, we again, please ask you to fill out the survey. It's less than 10 minutes and it really is very valuable for us and for this work. We will hopefully bring our working group together shortly. We'll have some invited speakers. We have talked to different division heads, and there's been already interest in setting up workshops on allyship and microaggression and tools to deal with those. And we hope to have an update in the spring of this coming year to tell you where we're at. So I guess I'll stop there, Jim, please. And next slide. Please reach out to us. Our emails are available. Our website is up already, but we'll build on it. And I'll stop here.
Great. Thanks very much, Najib. Thanks, Laura. Excellent presentation, and we look forward to supporting all of your efforts in the Department of Surgery. And a plea from me to all of you also to, when the survey comes your way, please take a moment to fill it out so we know who we are and how we can best serve our entire faculty. Okay, so next, about 2 years ago, I was approached by Andrea McCart, General Surgeon at Mount Sinai, Associate Professor, saying that she was interested in putting together a white paper on best practices in parenting. And I thought this was fantastic, and I was wholeheartedly behind this effort and supported her. So I've asked Andrea today to prepare a presentation on this topic for us to let us know where we stand. I actually took some of the work that Andrea did and presented up at the Dean's level, Dean's office in that clinical chairs meeting not too long ago, and it was met with a lot of enthusiasm. So I'm going to stop sharing my screen, and this should allow then Andrea to take control because she's going to show her slides. So Andrea, over to you. Okay.
Okay, there. Okay. Can you hear me okay?
Yeah.
All right. Good morning, everybody. And thank you, Dr. Rucka, for asking me to give this presentation. So before I start my talk, I just wanted to thank the people that have helped out so far with this initiative. Obviously, Dr. Rucka has been very supportive in getting this going. Joanna Giddens has actually done the majority of the work in terms of getting the survey online and sending it out and putting together the data for today's talk. And also Karen Devon read over the first few iterations of the survey to make sure that it made sense and that I had captured the major things we wanted to ask. So just a bit about how this came about and why I did suggest this to Dr. Recca 2 years ago. I had my kids mid-career, and I'm a surgeon scientist and surgical oncologist at the Lunenfeld and Mount Sinai Hospital. I'm a surgeon mom to a 5-year-old and a 15-month-old, and over the past 5 years have had 2 maternity leaves, a 6-month one to begin and then a 3-month one last year. And in both times I had a locum to cover my practice. Luckily, my locum agreed to also share my practice. She also, Dr. Daniel Bischoff, has 3 kids. So I think we come to this relatively equally. We both have a day off a week, which lets us be pretty flexible in our practices. And also, my childcare over the years has been my husband, who took 2 6-month leaves for both kids, as well as daycare, and if public school ever starts again, public school. And so my reason for doing this is not because I had problems necessarily at my hospital. We have a very supportive surgeon-in-chief in Jay Wonder, and the division has been very supportive and covering call and covering ORs and things like that. But when I talked to Dr. Recca, he had called me for an appointment, and I thought he was going to tell me I wasn't meeting up with things post-child, but actually that wasn't the reason. But I was so anxious about this whole post-child evaluation that I said, you know, why don't we have a policy in the Department of Surgery, not so much about maternity leave, but when you get back, like your academic assessments and your promotions, like what is it back to usual, or and it was the whole process of maternity leave and assessments and everything else was really a black box that you know, you didn't know really what was going to happen. So that was my motivation to do this. As Dr. Recca mentioned, we did put together a white paper already last year that was quite small, and I wanted to wait before it was really published to get the results of the survey to make sure we were capturing the needs of everybody in the department. And so thank you for everybody who filled out the survey. 93 people responded, and I think that's a relatively good response rate given that 89 of the responders were parents. So I don't really know the numbers of people who aren't parents, but we expected mostly that the parents would answer the survey. Of those, 61 people have had at least one child as an attending, and so we asked that people base their survey answers on the child that they had as an attending, as opposed to as a resident or a fellow, and those are all different issues. Interestingly, so of the 61 who have had a child as an attending, 2/3 of the responders were male, which is good. This is not just for surgeon moms, it's also for surgeon dads. The majority were from general surgery and orthopedics. There was good representation from both the academic hospitals as well as community centers. And interestingly, the majority of kids, probably 45 of the 61 people have 2 or 3 children. Some people, 8 people I think, have 4 kids, which I can't even imagine. Most people in the survey took 0 leave, which was interesting to me. And many of us have spouses to help with childcare. The majority did not have any practice coverage, such as locums. And we asked the question, like, what's the biggest challenge of being a surgeon parent? And we got lots and lots of feedback, and I don't have time today to go into that. If anyone's interested, I'm happy to share it, but we will be publishing this in some form down the road so people can actually see what the issues are. But Joanna has grouped them into several themes, which are a bit shocking, but not really surprising. The first one is not surprisingly physical exhaustion. I think both during pregnancy, operating until you're almost 40 weeks pregnant is exhausting, and then after you have a baby, being up all night with the baby is exhausting, and then coming back to work with a baby who's up all night is challenging, to say the least. Another issue was breastfeeding. Not everybody comes back to work to breastfeed, but the majority thought that the facilities were inadequate and also challenging to schedule around surgery and so on. Another theme was coverage of your practice. There's generally no assistance in finding a locum, for example. I lucked out in finding mine, but the majority of people have trouble getting a locum or getting one to stay for your maternity leave. And also, there's not really a lot of support to help you rebuild your practice when you come back after maternity leave or paternity leave. There's many financial pressures, both while you're on leave, because when your income is based on operating, obviously that doesn't happen when you're off. A lot of people said they would have taken longer leaves if it hadn't been for financial issues. And obviously childcare, having a nanny or daycare is quite expensive to add on to your income. There was issues of collegiality. Many people related that they were expected to pay back all the call they missed while they were off on maternity leave. People were expected to operate until they were full term, things like that. There were issues, and this was one of my concerns, about promotion. So people are overlooked for leadership positions when they're on maternity leave or recently back from maternity leave. There's potentially an unrealistic expectation in terms of your publications and grants and teaching amounts, especially when you come back with small kids. Issues with the leadership, that there's bullying going on for taking this time off for both men and women. There's not a lot of support in the logistics, such as getting coverage, and also there's not a lot of support in navigating promotion. And a lot of comments were, the package you have to fill out for the promotion, like nobody has the time to do that when you have little kids. It takes so much time away from your family that nobody's going to apply for promotion. There's psychological issues, such as guilt for not being at home, and then feeling like you're not pulling your weight at work, and then burnout from trying to balance work and family demands. Anyway, so that's just a brief overview of the survey. I've kept it relatively general because I don't want anyone to recognize themselves or their colleagues in terms of confidentiality. But there's a lot of data that came out of a survey, and so I really appreciate everyone participating. The next steps for this are to, I think Jim has already started to scan what's happening in policy in terms of other departments at our Faculty of Medicine. And I have reached out to other departments of surgery in the country to see what policies are there, just to see if we have to, what we can take from that. We plan to, in the next few months, to start to get more information on these issues through either phone or Zoom chats or focus groups. It's all going to have to be online, I guess, and to get feedback. A lot of people offered suggestions in the survey and volunteered to help with read the white paper results and so on. So I'll take people up on that. And then lastly, the end goal is to expand the white paper that we've written to create departmental policies. But obviously a lot of these issues are at the hospital level or division level. And so hopefully at least the white paper will go to inform hospital leadership about what the Department of Surgery would like to see happening in the hospitals in terms of parenting and surgery. And with that, I'll turn it back to Jim.
Great, thanks very much, Andrea. If you could just stop sharing your screen, that's great. And I'll start sharing my screen again. So, ladies and gentlemen, I think you can see that the two are related, right? The parenting presentation you just heard from Andrea, and the EDI presentation from Laura and Najib. So I thought it was very important to present those this year, and I'm glad that we could showcase those, particularly during my annual address. Okay, in the time that remains, just to go through the awards and honors, grants, etc., and there are a lot of them, so we'll be breezing through these fairly rapidly. At the outset, I do wish to apologize to anybody who's really strong and good work we've missed. We try to keep a very good database on all of you. There are some gaps, and if we failed to mention your name here, I apologize. However, we're doing the best that we can. This year we held the first inaugural Merit Awards, and these are the recipients. So Catherine Howe, Augusto Zani, Jonathan Young, and Kim Choi. This is $50,000 over 2 years. First time ever in the Department of Surgery that we've supported junior faculty with their research work. Other honors and awards, Michael Failings, Karen Whitnick, Kyle Wanzel, Jim Mahoney, Yana Dengler, Christine Novak, Leila Kasrai, Najma Ahmed, big award from the CPSO for her work in advocacy. Congratulations, Najma, to you. Osami Hanjo, Renki Lee, Kazuhiro Yasufuku, Charles de Mestral, Ahmed Casey, Mohammed Kadra, Graham Rochenagel, and their awards. Mohammed again, John Byrne, Ole Antonishin, Tim Sproul, and the awards that they received. Michael Failings, John Byrne, Stefan Hoffer, Catherine Howe, Tyrone David, Lifetime Achievement Award for the American Association of Thoracic Surgery. Congratulations, Tyrone. Steve McCabe, Barb Haas, Robin McLeod, Officer of the Order of Canada. Congratulations, Robin. Catherine O'Brien, CRC Tier 2. Congratulations. Charles Tatter, Order of Hockey. I didn't know that award existed. John Semple, Ron Zucker. Okay, grant recipients. There are numerous grant recipients. Again, with apologies if we missed your name this year. Again, this is for the academic year ending June 2020, so the recent CIHR awards are not included. So everybody's name is listed here. I'm just going to leave this up for a moment so you can see there are a few pages here, but just look at the names, of course, the agencies like CIHR, the amounts of funding that our faculty are receiving. It's very, very impressive indeed. Page 2, other awards you can see amongst our faculty members. Lots of CIHR project grants, as you can see here across the board. Tremendous large grants coming in, which is very reassuring at a time when it's tough at the grants panels. Page 3, again, CIHR awards. I think Abaya Kulkarni, largest grant award. I think this is at $9.6 million US. So congratulations, Abaya. Mark Jeschke, another NIH grant. Congratulations, Mark, 1.3 million here. Other grant awards that are listed on this page. And another page, you can see very good representation at the CIHR. Congratulations to our faculty. And another page. So congrats again, all listed here. Lots from the Tri-Council agencies. Very, very proud of faculty for all of your efforts, especially this past year at a time when it was really difficult to receive funding. So there, a word of congrats to all of our awardees and all of our grant recipients. Okay, we held 2020 Galley Day and the Gordon Murray Lecture. It was a virtual success. When we first started thinking about it, when the pandemic rolled around, we weren't sure we were going to hold Galley Day this year, 2020. But thanks to Michael Failings and Val and the group and the research committee, we did. And Professor David Rogers came and spoke to us on a very important topic on provider well-being. I think you'll agree it was an excellent symposium that was held that day, in a combination of of platform presentations and poster presentations that turned out extremely well. So we were very pleased to have held Galley Day and the Gordon Murray Lecture again this year, despite its virtual nature. We did have winners from Galley Day, and some of you, normally we would have our gala banquet event where these awards are handed out, but this year we had another Zoom meeting and presentations of these awards, and that was a very good event, but it was done virtually. But Jeff Wilson, Natalie Coburn, you'll be hearing from them later this academic year when they give their presentations in November, I believe. Tyler Chesney, Anna Dare, Abdullah Bazadi from Mississauga, congratulations. Tom Forbes, Caleb Zavitz, Jim Waddell, John Semple, David Urbach, Jesse Wolfstad, and Aaron Naus. So these are the major awards in the Department of Surgery, so a round of applause for them. And in the news, so we've had a number of faculty who have made the headlines this year, but first, just to remind you, in 2020, we ranked number 4 in terms of positions in the world in the departments of surgery after Harvard, Johns Hopkins, and the University of Pittsburgh. So we're delighted about this ranking in the US News and World Report. Some other headline items: Moji Hodai, 1,000 procedures for trigeminal neuralgia. Mark Jeschke, continuing with his 3D skin printer technology. Nir Lipsman and the use of deep brain stimulation for addiction related to alcohol usage. Galerizade speaking about the paucity of female neurosurgeons across the country, 333 neurosurgeons in Canada, but only 36 are women. So advocating for more women in surgery. Shaf Kashavji and Renki Lee, grant capture, and also very interesting new test during the pandemic to find out those who are at highest risk. Peter Stotland, North York General Hospital, on the news speaking about how at times isolating it was to be a frontline worker in general surgery at a community affiliated hospital. Excellent news piece. Theodore Grancharoff, and Time Best Inventions in 2019. Congratulations to Theodore, learning from medical mistakes. And Catherine Howe, speaking to Kelly Cutrara about could COVID-19 be a vascular virus? So many of our faculty were in the headlines for the great work that they're doing, and very proud of all of their efforts. Sunit Das, speaking about cancer stem cells and how relevant those are now in terms of cancer treatments and moving forward into the clinics. David Urbach discussing checklists, cancer treatment, wait times, and medical devices in surgery on SoundCloud. And as we are wrapping things up, coming your way in this coming academic year, even with the challenges of the pandemic, we were able to make headway on our invited speakers for the year. And here I'm listing them for you. The Bigelow Lecture is coming forward October 2nd, so next month. The chair from Cedars-Sinai, hosted by Terry Yao, will be giving a presentation. I mentioned the Lister and George Armstrong Peters lectures that'll be coming forward. The Robin McLeod Lecture, given by Professor Tellum from the University of Michigan. Steve Scher will be speaking to us for the Ben Allman Lecture. He's the director of the McLaughlin Center. I was very pleased just recently to secure Lindsay Fitzharris. She's an author in England who wrote the book, The Butchering Art. It's all about the dawn of the era of antisepsis and Joseph Lister and all of his contributions. And as you know, there's a portrait of Joseph Lister hanging in the Department of Surgery boardroom. So this is an excellent book. Perhaps some of you have read it, but she's agreed not only to give the lecture, but to sign copies of the book that we'll make available to all of you. So look forward to the Kurgan Lecture this year. The Palmer Lecture and Harlan Smith Lecturers were mentioned earlier. They're coming back this year. And the Tile Lecture hosted by Avery will be announced subsequently this year. My review, external review in the Department of Surgery was postponed because of COVID. It was supposed to be held in April this year. It's going to be held February next year. Professor Ahuja and also Professor Reed from Yale and McMaster University, respectively, will be coming to give those external reviews. And also, this will be done in a virtual format, pretty sure about that. Given what you've heard today in the Department of Surgery, where we are in terms of our world rankings, surgery by the numbers, I'm quite confident that we can impress these external reviewers. So I look forward to having them come review the program and then telling us where we should be, providing us with a blueprint for the next 5 years. Galley Day for May 7th next year, 2021. The venue is to be determined. We're hoping it can be held in person, but we'll see. We have obviously a formula now by which we can hold Galley Day virtually, so it's possible we could do it that way. We have booked the King Edward Hotel for our gala dinner next year on Friday, May the 7th. It was postponed, as mentioned earlier this year, but we definitely could hold it if we're allowed to meet in person next year. So, ladies and gentlemen, that concludes the annual address for this year. I think you can see the wide range of performances and achievements, abilities, talents that are within our Department of Surgery. Special thanks to Laura, to Najib, and also to Andrea for their presentations within my presentation. I was very pleased to hear about the directions of our EDI team and also best practices in parenting. Thank you for all of your support this past year and looking forward to this coming year. Good luck to all of you in the academic year that's forthcoming. I will be seeing a lot of you virtually in the weeks and months ahead, but I do look forward to the day when we can meet in person again, hopefully in 2021 sometime. And given the fact that my review was delayed by almost a year, it's more than likely that I'll be addressing you one more time next year for my swan song, my end of term tour of duty. And I look forward to doing that for all of you next year. So thanks all of you for joining this year. Have a great day, great academic year, and look forward to seeing you throughout the year. Thanks very much. Okay, bye. See you all.